Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,404 new cases of COVID-19. This brings our statewide total to 8,420 Pennsylvanians who have tested positive, now in 63 counties. Approximately 852 patients have been hospitalized since our first case was announced on March 6th. This is, again, approximately 10% of patients. 241 of those hospitalized have required intensive care, and 147 of those hospitalized have required the use of a ventilator or a breathing machine. Approximately 419 of our total cases are present in healthcare workers. And now approximately 12% of our 695 licensed nursing homes have at least one case of COVID-19. Tragically, we have now had 102 deaths among those who have tested positive for COVID-19, and all of those deaths have been in adult patients. Many Pennsylvanians have been asking if they have to go out, should they wear a mask to protect themselves? Now, all of the guidance that we provide to you is based upon the best available science at the time, but there has been a lot of discussion in the public health community, both nationally and, of course, in Pennsylvania, as to whether or not masks are effective in slowing the spread of the virus in the community. First, I want to emphasize that staying home is the most effective way to protect yourself and your family against COVID-19. But if you have to go out, because you need to go food shopping, or you need to go to a pharmacy to get medication, then wearing a mask or even a bandana could be an extra layer of protection. Now, you do not need a surgical mask or an N95 mask. We have to save those for our first responders and healthcare personnel that are on the front line in our battle against this dangerous virus. On our website, we now have a guide of how to make your own mask using materials that you have at home. Now, remember, a mask isn't a pass to go back to work or to go visit friends or to go out and socialize. A mask is one more tool in our toolbox to protect ourselves against the spread of COVID-19. Now, just like washing your hands and covering your cough are effective measures, it's important to remember that your mask protects me against exposure to COVID-19, and my mask protects you against exposure. So if the community that are outside at a food store are wearing masks, it does protect the community. Now, we have created resources for you on what type of mask you may wear and how to make your own if you can't purchase one. And those will be posted today on our website. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds. And as we all know now, that's the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover coughs or sneezes with your elbow, not with your hands. Try not to touch your face. Mask might help with that too, especially after touching surfaces. And clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the dangerous virus, COVID-19. Remember, if you have questions about your health, please contact your healthcare provider. If you or someone you know needs mental health resources because might be experiencing a mental health crisis, then contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I would like to turn things over to Governor Tom Wolf.
Thank you, Secretary Levine, and thank all of you for joining me today. You know, it's been 4 weeks since we identified the first case of COVID-19 in Pennsylvania, and we're beginning to see our first glimpses of the full force of this pandemic. Pennsylvania is continuing to climb to the peak cases. We're adding more than 1,000 a day to our tallies. And we know we have community spread occurring in many different areas. The only way we can cut the growth of this virus is to act as if we all have it. 2 days ago, I amplified our social distancing efforts by instituting a statewide stay-at-home order, building on the county stay-at-home orders, the business closure order, the school closure order, and other efforts over the past month. Today, I'm asking all Pennsylvanians to wear a mask anytime you leave your house. Masks help prevent people from sharing illnesses. They don't do a great job at keeping people from getting sick, and they're not foolproof. So it's critical that our first act, as Secretary Levine said, is to ask ourselves if we really need to leave our house. If we don't really, truly need to leave, then we shouldn't. Some trips are unavoidable. We might need to go to the grocery store to get food. We might need to go to the pharmacy to pick up medication. We might need to get supplies to care for our pets. Wearing a mask will help us cut down the possibility that we might be infecting an innocent bystander, like that grocery store cashier, the pharmacist, or someone stocking shelves. These folks are keeping us alive by getting us the supplies we need. We owe it to them to do everything we can to keep them safe. And right now, that means wearing a mask. We also need to do our part to keep healthcare workers safe. And so I am asking everyone to please reserve N95 and paper masks for these vital workers. Instead, use a cloth or a homemade mask. We have directions for making your own mask at health.pa.gov. And there are many other options across the internet on how to make your own mask, or how to acquire one from a community member who is making them. Universal masking is expected to be recommended by the CDC shortly. And in Pennsylvania, we want to be ahead of the nation in slowing the spread of COVID-19. We don't want to be behind it. And so far, I think we have been ahead of this curve. And that's in part due to the willingness of most Pennsylvanians to do the right thing. But we know we still have a way to go until we're through this crisis. And if we want to come out of it with the most Pennsylvanians alive and the best economic prospects, we all need to continue to do our parts. So please, stay home unless you absolutely cannot. And when you absolutely must leave home, wear a cloth mask. I know we're nearing several holidays, and that includes major religious holidays like Easter and Passover. I'm encouraging religious leaders hosting a holiday celebration to consider an alternative that does not bring people together in person. Many religious leaders have already found alternatives, such as streaming their services online so congregants can watch from home. I've even seen some churches try out hosting services in parking lots, with congregants remaining inside their vehicles. Any type of gathering can serve as a petri dish for COVID-19. In one case in Georgia, just one case, a funeral became the epicenter of a mass outbreak of this deadly virus. As a person of faith, I understand how important it is to worship, and that congregating, whether for a service or Seder dinner, can be at the very core of our faith. But I also understand how important it is to help neighbors. And the best way to help our neighbors right now is by not congregating. It's by staying home. Wearing a mask, washing your hands, avoiding touching others, those are great steps. But the most important one is to isolate yourself. Stay home. Congregants should be aware that even the most stringent prevention methods leave risk for spreading COVID-19. And religious leaders should avoid endangering their congregants. Please stay home, pray at home. Finally, I want to make one thing clear. Pennsylvania is a commonwealth founded on tolerance. And I'm disappointed and ashamed as a Pennsylvanian to hear that individuals have directed hate toward fellow Pennsylvanians of Asian background. No matter how stressful, frightening, or chaotic this pandemic becomes, we cannot let COVID-19 take tolerance away from us. I fully back the Pennsylvania State Police in pursuing charges against anyone engaging in a hate crime. But more importantly, I am advocating for all Pennsylvanians to take a stand against anti-Asian sentiments. If you see anti-Asian discrimination, please report it. Hate is just one more symptom of this terrible disease. If we want to win our war against COVID-19, then we all need to work together, each and every one of us. I will keep fighting to save Pennsylvanians, their lives, their livelihoods, and their way of life. I'm asking you to all step up to do your part in this fight. Thank you.
Governor, we'll go ahead and open it up for questions. For Dr. Levine, from ABC 27, recent projections suggest that Pennsylvania hospitals, unlike many other states, actually have enough beds and ICU beds for the coming spike in cases. Is that your understanding as well? And are Pennsylvania hospitals adequately staffed and supplied for what lies ahead?
So we have been working tirelessly with hospitals and health systems and with our county and municipal health department partners and the Hospital Association to make sure that hospitals have the number of beds that they need across the whole continuum of care, that they have the supplies that they need, such as the N95 masks, but other personal protective equipment, and then the other resources, such as ventilators, that we will need to take care of patients as we expect this surge to come over the next number of weeks or month. Depending upon which model you look at, right now the modeling is very positive that we will have adequate supplies to deal with this surge. But the key, as the governor has been emphasizing, is to prevent the surge from becoming high enough that it could overwhelm any healthcare system. And the way to do that is the social distancing and social isolation that the governor has been talking about. And that's why we have been discussing over and over again that it's so important for people to stay home and to stay safe.
Secretary, we have several outlets, the Altoona Mirror, News Talk 104.1, Lehigh Valley Live, and the Bucks Courier Times asking about this guidance about masks. Do you envision wearing masks in public will become mandatory? And if everyone is asked to wear a mask, does that mean that the dynamics of how the virus is transmitted has changed?
So it doesn't mean that the dynamics have changed than it's been over the last number of weeks, because we are seeing community spread of the virus of COVID-19. What's changed is the views of the public health community nationally and internationally and in Pennsylvania about the utility of the whole community using masks. Because again, my mask protects you and your mask protects me.
Secretary, as a follow-up to that, should we wear a mask during solitary recreational activities like running or hiking, or only if we're going shopping or somewhere else where people may be? And is a scarf an acceptable alternative to the cough masks?
So if you are truly in an isolated activity and you're not going to see anyone, then it's probably not necessary to wear a mask, because really it's the personal contact. But if you are out hiking, sometimes other people might be there, and so maybe you'd want to have it available. Scarves are potentially an acceptable alternative. So I think the cloth masks that the governor was speaking about are probably the best, but a bandana or a scarf are possible to use as well.
Governor, the next question is for you. I have several outlets, CNHI newspapers, ABC 27, and WJAC asking about correctional facilities. Can you shed light on whether you plan to order or seek to have medically vulnerable inmates released from the state prison system, and what protections would be in place to ensure public safety?
There are a couple of things. First of all, we're working with the legislature to streamline the process to administer the system where people who are ready to leave the prison can do so, and they're not held up by bureaucratic red tape. And I think the legislature is working very quickly on that. Within our prisons, we've also stopped visitation. We've also gone to a lockdown in all state prisons so that prisoners are isolated, and when they have to get together for like meals, we do that with small groups. So we're doing everything that we know at this point to keep our prison population and the people who are administering the prison system as safe as we possibly can.
Secretary, the next question is for you. From ABC 27, we've seen a surge in cases in nursing homes around the state. What is the department doing to work with these nursing homes if they see a rise in case counts?
So you are correct. The seniors living in long-term care living facilities, and that would include nursing homes, but also personal care homes and assisted living facilities, are at great risk in relation to this pandemic of COVID-19. They're older, and older individuals are more likely to suffer more serious complications, and then also more likely to have other medical conditions that could make them more vulnerable. So they really are our most vulnerable citizens. So at the Department of Health, in collaboration with the Department of Human Services and the Pennsylvania Emergency Management Agency, we're doing everything we can to protect nursing homes and protect the staff and residents of nursing homes. We are watching the data very carefully about nursing homes. Again, now about 12% of nursing homes have at least one case of COVID-19. We're working in terms of transfer of patients from nursing homes to hospitals and then back if necessary, and other ways we might be able to cohort patients for protection. We have issued guidance to long-term care living facilities with the Department of Human Services, and there's now just today new guidance from the Center for Medicare and Medicaid Services about patients with nursing homes. We're also looking to contract with a company that will help us and serve as almost like a nursing home SWAT team that could go out and help a nursing home that might be having difficulty and helping them with their infection control. And so we're going to do everything we can to protect the health and safety of nursing home staff and nursing home residents.
Secretary, from WNEP and WBRE, questions about the increase of cases in the Hazleton area and Luzerne County. In terms of outreach, how do you plan to continue to reach the Hispanic community? And then also in terms, are you looking at potentially temporary field hospitals or mass testing sites?
Mm-hmm. So yes, all of our materials have been translated into Spanish. We also have a publicity campaign about the things we've been talking about staying home, about the importance of hand washing. We'll put the information about masks on that, and that is also available in Spanish. So we'll be reaching out to the Hispanic community to try to protect really everyone, of course, in Pennsylvania against this deadly virus.
And then as a follow-up to the question, the mayor of Hazleton just placed a curfew in place starting Saturday night along with other restrictions. Is that something that you feel is helpful in this?
Well, that's a local decision by the mayor, but we want to do everything we can to support this social distancing and prevention and mitigation effort led by the governor in terms of the stay-at-home orders to keep people safe from the infection with COVID-19.
Governor, the next question is for you. From the Daily Press, We're seeing on social media that despite the statewide stay-at-home order, a number of people in areas with a sizable amount of COVID-19 cases like Pittsburgh are continuing with plans to make trips to our rural counties that currently have no or few cases for activities like elk viewing, horseback riding, and visiting their camps. Is the state considering putting any additional enforcement measures in place to further curb some of this non-essential travel and limit the additional spread of the disease?
No, not at this time. We're not planning any additional enforcement. And the main enforcement, again, is self-control. Do you really want to go out and jeopardize the lives of people you love or neighbors or other Pennsylvanians? And I think the answer that Pennsylvanians give on that is, no, I don't. And so the answer is not to go out. It is not to congregate. It is not to be with other people. It's to stay at home. And that's pure and simple what we need to do. We can put all the enforcement in place. We can do all the things that we have to that might seem like the right thing, but ultimately we're going to win or lose this battle by what each individual Pennsylvanian decides to do on his or her own. And stay at home is the right way to handle this.
Secretary, the next question is for you. Several outlets, Fox 56 News, the PLS Reporter, and WTAE, are asking questions about documents released by FEMA on personal protection equipment. It shows that Pennsylvania has not received as much from the federal stockpile as requested. Is there any indication that this will change going forward? And has the federal government provided response in helping to meet the gaps in our needs?
Well, so we have had a number of requests for personal protective equipment and other resources to FEMA and the federal stockpile. We have received resources. We did not receive all the resources that we asked for, but we did receive resources several times. We are also really scouring Pennsylvania and other places in the United States to purchase those type of materials, such as the N95 masks, gowns, ventilators, and we have been successful in purchasing those and are expecting orders all the time. So in addition, we're looking everywhere we can for this type of personal protective equipment, and I know that we're looking even, if possible, to make the equipment, or different ways that we might be able to even sterilize personal protective equipment, such as the N95 masks. So we will do everything we possibly can to supply the resources to hospitals and healthcare providers that they need to take care of patients with this dangerous virus.
Secretary, we have a question from Spotlight PA regarding modeling. Their questions are that projections passed on Penn's chime model show a peak in July. Is Pennsylvania going to release any projections to the public? And is it possible we could see cases continue to rise through the summer? Could you recap your explanation about modeling?
Sure. Well, the one thing about modeling is I really agree with Dr. Fauci, is that actually the virus determines the timetable. We don't determine the timetable. And so models are exactly that. They are estimations. And there are many different types of models. It gets very complicated. And also they're very dependent upon many of the variables and assumptions that you put into the model. So we are working, as I had said before, with the University of Pittsburgh School of Public Health on their model. I actually have a phone call with them tomorrow on Saturday to discuss their model and discuss some of the assumptions that they're making and trying to perfect that model. We have been looking at the model from Penn, which is primarily concentrated on Philadelphia. There's also a University of Washington model, again, different characteristics, some positive, some negative. That model shows at the moment that's one of the models that shows that we certainly will have enough supplies and beds to deal with the surge. We don't know exactly when the surge is going to come. We don't know exactly the timetable. Much is going to depend upon the mitigation efforts and the stay-at-home orders and how people react to those. As the governor was saying, we are depending upon everyone in Pennsylvania to do the right thing and to stay home to prevent the spread of this deadly virus.
Governor, the next question is for you. From the Pittsburgh Business Times, are there any plans to extend the waiver deadline for businesses to apply to be considered an essential business?
No, the waiver deadline is 5 o'clock this evening. And let me just add to the point. I think there have been two questions now on modeling, and the Secretary, I think, has answered absolutely right. There is one answer to the models, and it doesn't matter which model you use, doesn't matter how sophisticated the algorithm of the model. It all comes down to it depends. It depends on what we do. If we stay at home, if we practice social distancing, if we actually nip this in the bud, then the models are going to show that we are not going to exceed the capacity of the healthcare system. If, on the other hand, we don't do the right thing, if we congregate, if we spread this disease, because it is a very contagious disease, if we spread it, then we're going to overwhelm the healthcare system, and the peak, whenever it comes, is going to be just awful. So I think we need to understand, we look at these models, and they're very helpful in trying to help us figure out what we need to do. But in the end, it all comes down to what 12.8 million Pennsylvanians decide to do to make sure that this virus does not spread.
Thank you, Governor. Those are all the questions that we're able to take today, but for any reporters whose questions we were not able to get to, the Department of Health and the Governor's office will follow up by close of business today. Please stay tuned for our next briefing tomorrow.